you guys. Thanks for joining me for another podcast, another episode of Let's Keep It Real. And that's what I'm going to do today as I join you again just to bring you up to date on what's going on in the world as we tackle this COVID-19 coronavirus pandemic. As of Monday, there were more than 40,000 confirmed cases in the United States and nearly 500 deaths, and medical experts urge that an immediate 5-week national lockdown is needed to defeat the virus. Locking down the country would reduce infections and allow time for massive testing. Otherwise, there will be staggering human and economic costs if we delay. In the meantime, Donald Trump said he intends to reopen the United States from its shutdown sooner than in 3 or 4 months, as some experts have predicted the lockdown should last. He even said he might consider such an order when a White House mandated 15-day period ends next week. However, it's unclear if state and local officials would even follow such presidential guidance, especially in hard-hit areas like New York and Seattle, to which the U.S. military is preparing to deploy field hospitals. It is expected that there will be a rapid increase in the number of cases in the coming weeks as more people get tested or enter the phase where the disease presents itself full-blown. Americans are stranded abroad and are on their own having difficulty getting back to the United States as airlines drastically scale back on flights amid closed borders. Meanwhile, Norway last week urged its citizens to leave the U.S. with its inadequate health care service and head home. And in New Jersey, there's plans to release low-risk inmates serving county jail sentences to limit the spread of the virus, making it the first state to take such a step. It is still the only state in America doing this. And here are some stats at a glance. Globally, more than 15,400 people have died from COVID-19 globally. An estimated 100,000 of the 362,000 people who have been diagnosed with the disease across the world have recovered. On Monday, the World Health Organization stated that the pandemic is accelerating, with it taking 67 days for cases to reach the 100,000 mark globally, 11 days for cases to reach 200,000, and just 4 days for cases to reach 300,000. And those numbers are staggering. In a matter of weeks, Indonesia, the world's fourth most populous nation, went from reporting 0 cases to having the highest death toll in Southeast Asia. The capital is under a state of emergency, and an archipelago of 18,000 islands has effectively sealed its borders. Jakarta announced its first 2 cases on March 2nd, and now there are at least 579 cases and 49 deaths. And Italy, which is taking a beating, now reports 602 new coronavirus deaths, with its death toll reaching 6,077. Total cases rose to 63,928, but the number of reported deaths in the country dropped for a second day in a row after on Sunday reaching an all-time high of 793. The United Kingdom's death toll increased by 54, bringing the country's total to 335, with 6,650 cases. Prime Minister Boris Johnson ordered residents across the country to stay at home. Meanwhile, New Zealand prepared for a complete lockdown from Thursday. With a population of about 5 million, they have registered 102 confirmed cases and thankfully no deaths at this time. The West African states of Senegal and Ivory Coast have each declared a state of emergency. Senegal will impose a dusk to dawn curfew, while Ivory Coast said it would introduce gradual confinement measures. And Ontario, Canada's most popular province, said Monday that non-essential businesses must close for at least 14 days starting at 11:59 p.m. Tuesday, while the French-speaking province of Quebec ordered all non-essential businesses to close until April 13. In Turkey, the death toll has increased by 7 to 37. The number of confirmed cases rose to 1,529, up by 293. 3,672 test results had emerged in the last 24 hours, bringing the total number of tests carried out in Turkey to above 24,000. And in France, plans are afoot to tighten its imposed lockdown, strictly limiting physical exercise and closing most open-air markets, amidst reports of 186 more coronavirus deaths and a rising total of 860 cases. The number of cases had risen to 19,856, 20% in 24 hours. 2,082 people were in serious condition needing life support, an increase of 19% compared to Sunday. Cyprus has announced a lockdown on the island until April 13, and in Abu Dhabi, Etihad Airways said that effective immediately, only citizens of the United Arab Emirates or diplomats would be allowed to board its flights from overseas destinations, and only if their final destination is Abu Dhabi. The UAE is suspending all passenger flights for 2 weeks from Wednesday to contain the spread of the coronavirus. Meanwhile, in Algeria, an imposed curfew in the capital starts at 7 p.m. and ends at 7 a.m., and a full lockdown in the town of Blida, center of the worst outbreak in the country, with both measures starting on Tuesday and lasting for 10 days. Ireland's health department has reported 2 more deaths related to coronavirus, bringing the total of fatalities in the country to 6. An additional 219 cases have been confirmed, bringing the total to 1,125. The Dutch government said it would strengthen an existing ban on public gatherings and extend it from April 6th to June 1st. Police are now able to break up groups of more than 3 people in public and levy heavy fines if necessary to enforce the ban. In South Africa, they will impose a nationwide 21-day lockdown from midnight on Thursday. The army will be deployed to assist the police during the lockdown, and South Africans will still be able to leave their homes to buy food, seek medical care, and collect their social grants. And as I end tonight's broadcast, if you feel sick and think you might have the virus, here are a few things that you should do. Number 1, take a deep cleansing breath and stay calm. Number 2, assess your symptoms, understanding that anosmia, which is the loss of smell, has shown up as being one of the early symptoms of the infection, as has losing your taste. Previously, the symptoms which were associated with the virus were runny nose, a cough, and a fever. But now, people are losing their sense of smell and taste. Number 3, call your doctor immediately. Do not go to the ER. Do not go to the doctor's office. Do not leave your home unless the doctor tells you to. Tell your doctor everything, where you've been, who you've been in contact with, and if you have recently traveled. And upon your doctor's suggestion, get testing if testing is available, because remember, testing is still very limited, and even though there is drive-through capability in New York where they're administering drive-through testing, it's not available for everyone nationwide. Stay calm and treat it as if you have a bad cold or the flu. And get lots of rest. Isolate yourself at home. Stay in a separate room, and if at all possible, use a separate bathroom. Please observe any rules that have been put in place by your local government. Practice social distancing if you must go out for essential items. Otherwise, stay indoors. Remember to take extra care to sanitize surfaces and wash those hands for 20 to 30 seconds, then keep them away from your face. Take care of yourself, take care of your family, check on elderly neighbors, and join me next time. This is Anya saying, bye now.